Whether you snore at night or sleep with someone who does, chances are you aren't feeling well rested right now. So I brought in the foremost expert on everything sleep, Dr. Michael Breus. Now, he has a plan anyone with sleep issues is going to want to hear about. And this plan is going to help us specifically. It's got dual purpose. It addresses snoring, but it also addresses how the partner of a snorer can get a better night's sleep. So the first tip he gives is to position yourself for better sleep. So first, let's tackle the snorer. How should they be sleeping?
Okay, so when you're thinking about positions, first of all, really interesting piece of information that the person lying next to the snorer, there's data to show that you lose an hour's worth of sleep a night. And I think we saw that in the truth tube for sure. So he's definitely hurting. Turns out that sleep position has a lot to do with snoring because, for example, if you lie on your back, oftentimes gravity pushes everything to the back of your throat and you have a greater likelihood to snore. That's why the elbow to the ribs and the roll over seems to work so well for so many people. But what people don't know is we're going to show you a way that you can sleep on your back and help reduce snoring.
And is it better to sleep on your back?
Generally speaking, it's actually better to sleep on your back because you have more surface area by which to hold the weight that's on your skeletal frame. If you're on your side, you actually crush the side and it makes you want to move more. So believe it or not, the best position to sleep in is actually on your back.
So both of you don't mind hop in bed here. Okay. Don't do anything else besides that, by the way. Daytime show, okay. So if you don't mind, if you can, teach Deja, if this is, well, that's...
Wrong?
No, I'm happy you did it wrong.
Okay.
Because I want people to understand how to do it right. So you got them a little, if you don't mind, sit up for 1 second.
Yep.
So you got this little pillow. It's a little triangular pillow. You all see this here?
Yep,
All right, so
the wedge.
The wedge. We want people to buy the wedge. And where should they be putting it? Not like Deja just did it.
So what you want to do is you want to have the bottom of the wedge actually at the base of your back because you want your entire torso to lift up. So now go ahead and lie down for me. And your head, see, it's almost off the edge. Right?
Yeah.
That's perfect for you because what we're doing now is we're moving gravity sort of out of the equation here. And you can get a wedge that's of different sizes depending upon what your comfort level is, but you want it to be about 17 to 18 degrees or higher to be able to get this effect.
Is there a certain density of the foam?
So different densities are going to depend on the weight of the individual. She's small, so we don't have to have a really high density foam, whereas if we had it for you, we might have to have a deeper or thicker density foam.
And what about for Paul? If Deja still snores, even with the wedge.
So even if she's still snoring, then what we'd have you do is we'd have you change positions, and you would turn towards me, and Paul, you're going to turn away so that you guys are back to back. So in this instance, we're going to switch out the wedge, and we're going to have a normal pillow, because if I had you on a wedge while you were on your side, it would hurt your back, right? So since snoring is actually a sound wave, which is a matter wave, if our ears aren't next to it, we don't hear it nearly as much. So by being back to back, it turns out that you're actually not going to hear the snoring nearly as loudly. But not always the best thing, right? So what you can do...
Paul's mind's in one spot here.
Is if you wanted to, you could actually turn towards each other, so you could switch around. But what I have people do then, Paul, can I steal one of those pillows from you?
Absolutely.
Is you would actually put a pillow barrier right here between the two of you.
Gotcha.
Okay?
Very romantic.
I know. But it's less romantic to be sleep deprived, trust me. And that can help with things as well. Also, Paul, earplugs might not be a bad thing for you to consider. But when you're looking at earplugs, the foam-based earplugs, you want to have them noise level rated at 32 or below. Okay. And the reasoning is that way you can still hear the smoke alarm.
Gotcha.
All right, here, hop up. But I do think people could probably lie, across America with their backs to each other. Would you be able to do that?
Sometimes we do that as a resort. We have to resort, or at least I do. I resort to. I try to analyze how she's. You wake up, okay, and then you respond to that. So, I guess we could do that. We've done it in the past, laying back to back with each other. But I prefer to lay on my back because I used to lay on my stomach, and I've had back issues. So my back hurts.
If you laid on your back, then we would have Deja then face away from you. So you can stay on your back because it's more comfortable for you, and you would be facing away. That way the sound waves travel this way and not towards you.
Right. Who would think there's so much science about how you sleep in bed? All right, hop up both of you. We got a lot more tips to go through.
Here we go.
All right, the next step is to go on a snore diet, which you have over here. It turns out when you focus on eating light meals, they hydrate you, and they actually will promote deep sleep. Dr. Breus, if you don't mind, walk us through these wonderful tips you have. How do these meals help us?
So when you look at these meals in particular, one of the things that we're trying to accomplish here is we know that if you lose approximately 5% of your body weight, it actually can reduce the decibel level of the snore pretty significantly, and sometimes 40 or 50 decibels. So we're not talking about a tremendous amount of weight, a little bit of weight. And we didn't want you to be making one thing for one person, one thing for the other, so we're going to combine them all together. So here we've actually got a halibut, which is a lighter type of fish, not quite as oily, nice high in protein. Also, if you notice, there's broccoli broccoli in this. So what a lot of people don't know is broccoli actually helps you metabolize caffeine. So if you're having caffeine later in the day, and by the way, Mr. Energy Drink over here.
Just a couple, right?
Yeah, so let's talk about that for a second.
Okay.
You know, when you look at the different energy drinks, you need to be pretty careful because those can have a half-life in your system pretty long time, and it makes you more sensitive, easier to arouse while you're sleeping. So you end up in a lighter stage of sleep, and guess what you hear when you're in a lighter stage of sleep? Her snoring. Yeah. So there might be some, contribution of the energy drink to your staying up at night and hearing her snoring. So I'd rather you slow down on those pretty significantly if you can.
My goal would be not to use them at all.
That would be great.
That's my goal.
But if you are going to use caffeine, for everybody, remember the tip: broccoli, good for you for weight loss reasons, good for the non-sleeper because of the snore, because it metabolizes caffeine. And what's the last food you should love?
The last food looks like it's a stuffed chicken and a stuffed turkey maybe, and it's got grains and it's got a lot of good greens in it. Again, this is a nice lighter food, but it keeps you hydrated. If you notice, we've got a lot of hydrated vegetables here. So the more hydrated you are, it actually turns out the less you snore because your body, when you're very, very dehydrated, your body has a greater tendency to snore.
Real quick, so you have your daily intake of water. Should you add to that? So should she be drinking more water so that she's hydrated?
Well, number one, you got to make sure that you are well hydrated. The easiest way to see that is when you urinate, if it's clear, you know that you're well hydrated. So I would go off of that, and if you're starting to notice that it's more of a yellow tinge to it, then I would increase your water intake.
But there's another type of hydration we're going to talk about now.
Yes, there is.
This is to decongest yourself for better rest because congestion causes snoring. You may have noticed that yourself.
Yeah.
Deja, that allergies or just feeling full hurts you. So what do you recommend, Dr. Breus?
So what I recommend is using a neti pot. So this is a great way. This has been around for thousands of years.
Have you ever done this before?
Not with the neti
All right,
pot, no.
come on, let's do it together. Here you are.
So you actually help irrigate the nasal passages, and you use a little bit of saline or salt water, and you actually pour it up into one nostril. It'll actually swish around and then comes out
We'll do the
other
right
side.
nostril, all
Okay.
right? You gotta put her head down. Now, you don't just throw it down there. You gotta
wanna
do it
hold it
carefully.
there.
It's like-
Okay.
But it is like brushing your teeth once you figure it out. What a gentleman. What a gentleman.
I'm the victim.
I'm the victim. I'm the victim. My goodness. All right, you put it in one nostril, lean your head forward, turn the water over, and just keep going until it comes out the other nose, just like that.
Perfect.
How's that?
You got both doing great.
You're both doing it. You got to watch the whole thing out. I know it looks crazy, but it really works. Dr. Breus, what about the partner of the snore while I'm blowing my nose with this stuff?
So the partner of the snore absolutely can do this as well to help decongest yourself. But what this will do is it pulls out all of the congestion, all of the inflammation, all of the kind of the gunk and the guck that ends up in there all day long. Believe it or not, you might have a lot of allergens that are in your bedroom or that you take from outdoors that can actually have a pretty big effect on creating that congestion. Nasal strips are another thing that can actually be quite helpful, but you want to make sure you don't put them across the bridge of your nose. You put them lower down to actually help flare the nostrils a little bit and open up the nostrils, because a lot of people put them too high.
How's your neti pot experience?
Interesting, I can do that.
Interesting. What a polite response. All right. Now, and we've got one last little tip. This is for the partner of the snore in particular.
So one of the things we know is that aromatherapy can actually be very effective in helping people fall asleep. But remember, you don't just sniff something and pass out, right? Unless it's like ether or something like that, right? Chloroform would be bad. But what lavender does, there's actually double-blind, placebo-controlled studies to show that it actually helps a relaxation response and helps people get into deeper sleep. So for you, one of the things that we might consider is like a lavender spray on your pillow, because as you're breathing that in, you'll actually get more relaxed and brings you into a deeper sleep. Interesting, a lot of women don't like to put the spray on the pillow because it gets on their hair, and then their hair smells like lavender all day. So, but guys don't really seem to care.
No, I'm willing to do it.
I've really enjoyed you. I'm glad you love each other so much you want to deal with this. I want a lot of other folks to follow suit. It makes sense. For all this information we talked about today and all the information from our TruthTube experts, you go to droz.com. We'll be right back. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.